Dr. Collins, given the fact that the symptoms of long COVID mimic the symptoms of a lot of other disease states, I guess a very basic question is how are we just ruling out these other diseases coincidentally showing up in these patients? Unfortunately, some constituents suffer from chronic fatigue syndrome, ME, and they're very concerned, about that and wondered, that's an entity, as I understand it, unto itself. But one of the main symptoms that for folks with long COVID talk about is this chronic fatigue. It does. And with as I understand it, with some of the studies on chronic fatigue, they think it might be virally induced. Could it be that some of this has been other viruses, other things have caused this, and are there studies going on right now with long COVID causing or increasing the frequency of chronic fatigue syndrome?
There is certainly a lot of overlap in the symptoms, and I think we need to learn from that. People with chronic fatigue syndrome many times report an acute illness that sounded like it was a viral infection of some sort, a fever, maybe being in bed for a day or two, but then they don't get better. And that has a lot of overlaps now with what we're seeing with long COVID. With chronic fatigue, though, we almost never actually catch the original infection in the act, so we don't know what it was. But it could be that this is a pathway that other infections can also induce occasionally in individuals. My hope would be that as we study long COVID and look at those comparisons with chronic fatigue syndrome, we'll learn a lot about both of them. We'll figure out how they are similar, how they are different, and how, if we can identify interventions, they might work for both of those groups, because there's lots and lots of people with chronic fatigue syndrome who are still waiting for something that's going to help them.
Right. Yeah, might be some overlap.
Thank you very much, Madam Chair. I'm pleased the committee's holding this hearing today about the long-term health complications that can follow COVID-19 infections. I had the opportunity to meet with a group of COVID long haulers from Florida last week, and hearing from these patients confirmed my impression about the mysterious and lingering medical conditions that affect a number of COVID survivors, even long after the infection has passed. The group I spoke with had teamed with an advocacy group for myalgic encephalitis and chronic fatigue syndrome, as my colleague, Representative Schrader, just mentioned, diseases that also affect and debilitate multiple body systems, often following a viral infection. And their hope was, of course, that existing research on ME/CFS can shed some light on why COVID patients are facing an array of symptoms that are often similar.
I want to thank that. A lot of us have brought this up, and I just want to build on it. I think all of us also heard from a lot of constituents too who had chronic fatigue, and because I can tell a number of us have met with them, and they're worried about the amount of money that is being put into research. Do you have the resources you need? I met with a group of doctors. I've met with several different groups of doctors. Those at Michigan University feel more connected to you than single practicing primary care doctors. And I think this is really a major issue for us right now. The next panel is going to include patients who've shared their written testimony, their various experiences in going or seeking care in the primary care setting. So Dr. Brooks, can you expand upon what you have been talking about? How has COVID impacted primary care physicians, and how do we make sure, because a lot of them don't feel they've got what they need, how do we make sure they have the tools they need to diagnose this condition, and then where do they refer patients?
From my experience in HIV, I can also share something, which is maybe we focus a lot on this condition, but its benefits echo with other conditions. What we learned around the HIV virus benefited our knowledge around many opportunistic infections. It benefited infectious diseases in all sorts of different areas. Here too, what we may learn about managing and treating this condition will benefit those patients with chronic fatigue and ME.
I think I got the general gist, and particularly asking about CFS or ME/CFS and the relationship to long COVID and the need for research on both of them. And I agree with that. I've been very concerned for several years about the lack of understanding of ME/CFS and what the mechanism is that causes individuals to suffer from this oftentimes years of fatigue that are sufficiently severe to keep people almost bedridden. We do have a lot more research going on in that. We funded no less than 4 centers of excellence to work on CFS. Our own intramural program at NIH has a big program bringing patients to our clinical center for intense study with CFS. And the same investigators are now studying long COVID with the same mindset. So if there's an overlap between this, I think we're going to discover what that might be. And my hope would be that the fact that we are now able to put a lot of resources into studying the long COVID circumstance where we know what the inciting agent was, we know what the virus was, we should learn something that will spill over in a useful way into our understanding of CFS, and we'll be able to offer something more successful to those individuals who have suffered a lot for much too long.
So many of my colleagues have said before me today, and I'm looking forward to our next panel as well. But I think that our witnesses in this first panel have really been excellent in making it abundantly clear that long COVID is real. It can be debilitating. I really appreciated the answers just now about comparisons with CFS. That's certainly something that we have experienced here in our community, a lot of folks, and those challenges. But I'm very concerned, as I think has been made clear today, that once we get past this pandemic or get to the next phase of this pandemic and the majority of people are vaccinated, we're still going to have a health crisis on our hands. Certainly that has been made clear